I'm Beth Friedman.
I'm Joe Foster.
And this
is Finn Voices.
Hello, everyone, and thank you for tuning in. I'm your host, Beth Friedman. I'm senior partner at Finn Partners. I'm based in Atlanta, Georgia, and my guest today is Amaris McComas, Chief People Officer at TruBridge. So, Amaris, welcome to the show.
Thank you, Beth. I'm honored to be here. Thank you for having me today.
Of course, of course. I really wanted to dive into our topic today because a couple weeks ago, I had the chance to attend the HIMSS AI and Healthcare Forum. And once again, I was astounded by how fast our industry can move when pushed, right? Like COVID did it, high tech did it with the HRs, and now AI is doing it. But there is a lot more to the solution than just the tech, right? There's the people, there's the culture, there's the career shifting. And that's all what we're going to talk about today. I am truly impressed with what TruBridge is doing. You are innovating a legacy health IT company that I have known my entire career as CPSI. And at Vive last week, you all announced your new name of TruBridge. But it's not just a marketing new name. It has been a 2-year work project for you in changing culture, changing workforce, and really getting everyone ready. So that's what I want to talk about with you today.
I am so looking forward to the conversation. It is an ever-changing world. So let's get started and get to the nitty-gritty.
Okay. When we prepared for the call, you told me that one of the most important things to think about was the very, very beginning, which is your purpose. So setting a foundation of purpose. Let's start there. And I'm curious about your personal purpose and how you ended up as a Chief People Officer.
That's a lot, Beth. I will start with the personal side of the story because I would say a lot of people know me and I'm all about the what am I doing to add impact and have value every day. So personally, I've gone through multiple journeys in the healthcare system. I'll give you a highlight of 2. Number 1 is as a child, I spent a lot of time in the hospital. I had severe asthma, and I actually spent and saw like the clinician side and the care side of the hospital system. It was the patient, for many, many years. And that really shaped kind of how I perceived, one, healthcare and hospitals, but also the amount of care and the people that were part of that journey with me, and really the respect that I had for that community. So that's where my love started for the healthcare systems. And then I would say now fast forward, I have 3 children. And one of my kids has struggled with mental health. And on the flip side of that, he's met some wonderful people, but I've experienced the disconnect of the healthcare system. I've experienced the lack of resources and support that there is, not just for the patient, in this case, a youth, but also for the parents that are going through the process as well and are trying to caretake for someone that, you don't know kind of what to do many times. So I've really been in this place of learning and honestly, a place of being in a very different journey than maybe I anticipated a few years ago. But I've always had that passion because I think that you can make so much impact in this industry. And that's, from the healthcare systems, from the healthcare technology, from healthcare solutions, wherever you are in the spectrum of healthcare, there's so much opportunity. So that's really kind of where my purpose and my mission with healthcare started. And then I had the privilege to join CPSI around 2.5 years ago. And, this company has been amazing at really changing the way that we support the communities we serve.
Yeah, absolutely. And, bring in a good point. It really is all about the communities because you mentioned your experience as a child. You were a patient in a community, and now you're seeing the same situation with your child, right? At Finn, we talk about that all the time, the disconnected nature of healthcare. And you are correct about the purpose. Actually, I can reflect back on my own career and getting into healthcare. I wanted to be in this profession because at the end of the day, you are helping clinicians to help their patients. And I think that's 100%. So important. Yeah, absolutely. So let's kind of shift gears. So thanks for the personal story. Very, very informing and interesting. And when we talk about purpose as it relates to, let's say, a hospital, a health system, IT company, in some ways, we need to make sure that that whole organization is aligned with that culture and with that purpose. So, there at TruBridge, what were some of your first steps in moving sort of that culture from traditional legacy health IT to sort of this new innovative and agile organization we see today?
So we sat down as a leadership team and we said, what is our vision? What is our vision of this organization as we evolve in this market, in this world of healthcare? And the first thing we determined was our vision is to create thriving communities wherever we go. And what does that mean, right? Because that's so big and it's so massive. But we felt anything we touch, either in services or in solutions, we have to create those thriving communities. And as we think about what that meant, we clearly recognize that you can have the process in the system, but it was about the transformation of our culture. And one of the first things we did was, how do you take this people first approach? So, how do you think about your employees at the center of that transformation? And how do you help them collaborate better or differently? How do you help them embrace harder or different conversations so that you can innovate? Innovation is about making things better, improving anything that you have, making it better, right? It doesn't always have to be this one grandiose idea. It can be tweaking, can be process improvement. But for that to happen, your mindset has to change. You have to become much more of a learner. You have to be comfortable with the unknown, with the uncertainty. You have to be really clear about where the work happens and how decisions get made and how you shift that from a more traditional hierarchy to a more, individual, decision-making authority. So all those things seem really simple, but when you think about a culture that has been historically different, and it's, there's a lot of legacy, and legacy is not bad. Legacy is good. Legacy brought us where we are. But as we think of evolution and as we think of innovation, it requires different. So some of those mindset changes, some of the behavior changes that I mentioned are really at the front end of how we started this transformation, from our culture into more of an innovation and agile kind of mindset.
And I assume some of those cultural norms that have been built over the past, in your case, I guess, what, 40 years, they're kind of hard to change, right?
They are.
Yeah.
In healthcare, there's power in people, there's power in community, and there's power in new technology to achieve better healthcare outcomes. One company, TruBridge, brings together people, technology, and communities to clear the way for better care. With 4 decades of health IT experience, TruBridge is a trusted health IT partner with a broad range of services and solutions. From an HFMA peer-reviewed suite of revenue cycle offerings to community healthcare technology, TruBridge connects providers, patients, and communities with innovative solutions and a people-first approach. Visit us at TruBridge.com.
They're hard to change it. Beth, one thing that I'll mention is I've been through transformations before, and it's typically very similar. And we underestimate. So I'll share with you some of the learnings that even as going through it many times, every time we face the same level of challenges, which is embedded norms are hard to change. There are pieces of being a legacy 30, 40 years, and some, I'm sure some people hearing this may have been 100 years. And there are cultural norms that are embedded into each organization. And you can't underestimate how hard it is to change behaviors, and communication becomes so critical. So we tried to communicate a lot. It was not enough. We had to communicate more and more. We should have probably done a lot more cadences and different rigors around communication. So I know it sounds so, like, of course you have to communicate change. No, you have to make it the same and over and repeat yourself. That was one of the biggest learnings. And the second piece I'll highlight is when you have a cultural transformation in an organization, you have to get to a place of understanding that not everything that got you here will get you to the future. And more importantly, not everyone that is here has the desire to be in what the new will be of the future. So I think that allowing individuals and employees to understand what you're trying to do, but also giving them the opportunity to say this may not be the right place for them in the future. And having those really candid conversations really started changing the needle. And I'm not going to say we were perfect because we're not perfect by far, but we really tried to acknowledge that it is a different organization. The expectations are different, and we're also wanting to support our employees differently. So that may mean that some people are super excited, and that also may mean that some people may choose not to be in that journey with you, and that you have comfort and peace with that as a leader.
Right. And empathy and grace too, right?
Absolutely.
So
Absolutely.
to understand and on those honest conversations, that sounds like such an important part. When there are teams, employees, physicians, even for a hospital or health system that are just, that's not in their next 10-year plan, right? To do something totally different than they do today. So just to have the grace to understand that and to have those conversations, that's so important. And especially like I would think for hospitals and health systems, that's just mission critical to have those. Because at the end of the day, your employees are also part of your community, right?
They are. And, in the healthcare system, specifically in hospitals, right, we saw the shift post-COVID, right, of the workforce. And we heard nonstop about burnout. And I still, to this day, last week, I was in an appointment in a kind of health and wellness center. And, she used to be an ER nurse. She did it for 20 years and she decided to leave post-COVID, as many stories we've heard about that because of the stress of it. But the most important part that I think we have to remember is that the patient is at the center of care. So whoever we are supporting and whatever our role is in that, making that the focus on the technology tools we deliver or the patient care kind of process that we're trying to deliver. And I have empathy to your point, Beth, that so much has changed, even for clinicians, on what they have to do and what they're required to document, and it takes away from patient care at times. And I think that if we can remember what our purpose is, which is how do we make that the best experience possible and allow them to care for the patients by simplifying, improving, that's our goal. That's innovation. Again, going back to your comment, right? That's innovation.
Yeah, innovation, not just tech. It's also the people and the culture.
Correct.
I think that's going to be one of my taglines for today's show for sure. So let's go back to one of the requirements for cultural change that I mentioned earlier in the show. And I know I've heard you talk about, which is upskilling. So we have a workforce now. We've kind of ingrained the new culture. We know we want to be an agile learning organization. Where is sort of the skills that these people have? I heard it again at the HIMSS AI and Healthcare Forum that in many of the operational and administrative areas, especially, some of the teams and staff that we have today may not be the teams we need tomorrow. We're going to need new skills, new roles. Tell us a little bit about upskilling that you guys have done there at TruBridge.
Well, thank you for that question. I actually think this is a fascinating topic because it's not that new, but I would say it's getting a lot of steam. And I'll start by saying, number one, there's no easy way. So when you talk about upskilling specifically, I think that there's a couple of components. The work is changing, the technology is changing, the processes are changing, and then we have the global component of this, the globalization and the global workforce, right? So I think that this has been going on for a long time. I think how we think about roles, how we think about growth, how we think about investment in our people is continuing to shift because now it's no longer enough to have experience for many, many, many years in something, but it's probably more relevant what skills you bring to the table that are going to help us get to the future. So as we saw the workforce in the past, it was very much tied to years of experience. As you're seeing the workforce today in the future, it's very focused on what skills you have and the mastery of those skills. So let's start that at a macro level, right? That's a big shift from a workforce perspective. So as you think about the transformation and the skill and the upskilling, which is a term that I think is used significantly right now, there's a few things that we did at TruBridge that has kind of enabled us to start that journey. Number one, we had to design a skills library, and that seems like one of the easiest tasks. It's probably one of the hardest tasks because you think about skills, there's millions of skills out there. Most people have some level of HR information system, HRIS system. They typically come with some levels of skill libraries. Some also you can buy from different vendors. But at the end of the day, you have to know what skills you need and you care about in your organization. So to the comment you made, Beth, we can have millions of skills, but if it's not applicable to what we do at TruBridge, then it doesn't matter, right? So that was the first step. We defined, about 4,000 skills to start out with that were critical or important to us as an organization. The second piece is making sure that you have the system to be able to kind of turn those on and for people to self-ID, to self-disclose what their skills are and their proficiency level. And that is part of the process that we're in currently. It's really kind of identifying those, understanding the mastery. And then the third piece is how do you upskill? So once you identify the gaps, or also where you have maybe significant skills and understanding the transferability of skills, because some things you can transfer knowledge of a relationship management kind of role across the organization. If you build really good relationships, if you know how to influence, for example, that could translate into sales. That could translate to a customer support role. That could even transfer to some influencing roles across the corporate functions. So understanding what you have inventory-wise, identifying what is important to you, and then the work, comes around where do you invest? Mm-hmm. So do you want to invest in current upskilling? So do you have enough pool of talent that you can invest in certifications that are going to help people? Or do you have time to do that? Because sometimes, honestly, from a business, you have to pivot really quick and you have to build something and you don't have time to have people go through a 6 to 12 month learning curve. So you have to buy that. So you have to go out of the market and get that skill to come in the organization. So that's where this whole skills journey really happens. It's really complex. I think some organizations out there have been doing it for 10 years and building this whole skill repository and understanding their proficiency and then saying, we can invest in everything, right? There's no unlimited dollars. Most companies don't have unlimited dollars. So if we have some investment, where is it that we want to put it? What are the most critical skills that we want to make sure our people have or that we want to help them learn? And then if not, where are we going to get them from externally?
And Amaris, I can only imagine, you're speaking from the perspective of TruBridge, right? Formerly CPSI. But I think about this in relation to hospitals and health systems. Like, it is so hard for them to pull, let's just say a biller, right? Off of accounts for 2 days for training, right? Or even worse in the clinical setting, right? So hard to pull nurses or other clinicians away from the patient bedside to do some kind of training. So, I assume that it must really take a lot of decision making and a lot of thought at the hospital health system level as well, whether you invest or you buy, right? Like you said.
It does. I think it does you're absolutely right, Beth. It does for the hospital and healthcare systems as much as it does, for our organization. Because to your point, we have billers and coders, they're working relentlessly to get through the workload and through the different charts, et cetera. And that's their main purpose, is serving our customer. But I think that this goes back to when you make a decision, what are you going to be focusing on as an organization? And we know that for our people to be, engaged, for our people to be energized, for them to be able to better serve our customers and our clients, then we need to invest in them. And we need to help them, right? Gain the right skills to be able to perform their jobs. And to your point, if not, then we have to kind of buy that skill. But at the end of the day, even for us, sometimes those decisions are hard because you're taking them out of the line. So I don't think it's not there's no magic bullet, right, for what's the the option. But I think it goes back to when people feel you're investing in them, they're typically more willing to stay. They're going to be more fulfilled. They're going to deal with their customers better, with their patients better. So I think that it's an investment worth making. Obviously, as a people leader, I would say I should be saying that, but it is absolutely one of the conversations we have on a regular basis, even at our organization. And that also helps with mobility and growth and sustainability of your workforce, which we all know it's a precious commodity because it's tight. It's a tight talent market. People want to feel that they are doing a good thing, that they're giving kind of to to their jobs the best, but also that means that they want to feel that from the organization as well.
Yeah. And the healthcare workforce in particular, right? We hear it time and time again. Whenever I see or read about a CEO, like the top priorities of healthcare leaderships, it's always around workforce. That's like the number one. So this has been a really interesting plus timely discussion, I think. And then, you've got all this new technology coming in, right? Which is just going to push us. But I think thinking about the culture and the people first, the technology second. I wanted to ask you, speaking of people, I'm curious. You've been on this journey of, culture change, transformation, innovation, and building this agile learning company for like 2 years. What has been the feedback from employees? I'm curious about your customers as well.
That's a really difficult question to answer. And I'll tell you why, because it's all over the place, honestly. I think we have different camps, Beth. We have a camp, overall, I would say, overall from an employee perspective, the change has been welcome. So, and I'll kind of say that broadly, right? The change has been welcome because they are seeing, so we have said, we're committed to doing X and we're delivering. We're committing to doing Y or we're delivering. Sometimes though, there has been like shifts or there has been a little bit longer runways than we expected. And especially with the agile transformation as an example, that is really hard to do. Doing an agile transformation end to end is very challenging. You always get unexpected curveballs and you have to adjust. So it's taken us longer than we wanted to. And that's frustrating for the employees because they're waiting, right? They're waiting for the change and they're waiting for the new, and it takes longer. So I would say definitely overall has been positive. We started, about a year and a half ago, really when this process started pretty heavily, and our engagement overall went up. We definitely have conversations, hard conversations through that change though. We've had to have conversations with people that were not clear about what their future was in the organization. We had to have conversations about, positions that probably were not in the long term. So it's not all rosy and all beautiful. It is a very much needed change, but with change comes hard conversations. So I would say I don't want to paint it as it's all perfect because it's not. It takes a lot of work. It takes a lot of commitment from our teams, but also from our employees and from our leaders. It takes our leaders learning to have different discussions and making different decisions. And that is hard. So overall, it has been positive. Overall, we've seen a shift in just the people and the work they're doing and the speed by which they're doing some of the work. We've seen customers. So your other side was what are our customers saying? Our customers, last customer conference that we had in 2023 was probably the most engaging one we've had in years. People, the customer was excited to see what the end product was. We showed them what Agile could do. So when you think about putting together a cross-functional team to expedite the delivery of a product, either a new product, an enhancement, and getting it to the customer faster, and something that we had for a long time in our list of things to do, they were excited. They were really excited. They were excited that we were changing the expectations, right? They were excited that we were really focusing on what was most critical and what they've been giving the feedback for a while. They were excited that we are launching different ways of engaging our employees and our customers in process improvement through our Dream Factory. So there's been a lot of pieces that really positively have impacted the work that's getting done, the speed by which is getting done, and ultimately, obviously, those who serve in the communities we serve. That's been really great. It doesn't come without some challenges, and it doesn't come with kind of hard conversations. So I think that's what you have to be ready for. That if you engage in this transformation, it is, if you do it for the right reasons, it's really great. And it's going to ultimately all come together. But that process can be very challenging. And you need to have patience and give people grace and try to be as genuine as you can be through that.
Absolutely. There's an old saying I used to love to quote that change is never easy, but it's always worth it.
Yes. And some of us love change and some people don't. And I think that's the part actually for me is, and we talked about this, Beth, you and I said, I would say probably I can be called change junkie at times because I love change and I always look for ways to do things better. And I never not question something as it relates to, can we do this better? Can we do it simpler? Can we be more efficient? Are we trying our best? So I'm constantly asking those questions. And I think that's the curiosity and the level of, I would say, intention that has to happen in a transformation. But you also have to acknowledge that many are more comfortable with business as usual. And it takes a lot of convincing and discussing and making sure that you're showing the why on a change and why you're changing. And that's the piece that obviously is the most challenging. And some of the best transformations happen because of that process.
And patience. You mentioned patience.
And patience. They'll get the benefit of, a much more streamlined system, process, technology, whichever. Absolutely.
Yeah. Not to mention improving their career and, in general, right?
Yes.
Hey, you mentioned your user group. So I have been to many, many user groups. I've worked for several vendors, and I've obviously been with Fin Partners and my own agency serving lots of different health IT companies. So I've been to many of them. And I am going to reiterate what you said. This user group that you all had last, I think it was April maybe, in 23 in Orlando, that was the most fabulous user group I've ever been to. And the level of energy and enthusiasm from those hospitals that were there, I mean, it was palpable. It was wonderful. So whatever you guys are doing, you're doing it right.
It really was. And I don't have, I appreciate that perspective because I had two under my belt, right? So when you think about, again, culture transformation, this chief people officer job just has been around for 2.5 years in the company's history. And then as we think about the transformation of culture and innovation, so it has been a lot of change in a very short amount of time. But when I think about even the two that I've been part of, completely different. And the energy was different. And the energy from our customers was different. The energy from our employee population was different. And you could see it was so clear how transformation showed up in that meeting. Again, so much more to do, so much opportunity to make it stronger, better, different. But it really was palpable in that meeting, kind of that transformation.
Well, you guys have been on a 2-year journey. Congratulations on the new name, which just got announced at Vive, the Vive conference. We'll see you again at HIMSS. And it sounds like there's still more work to go and to do, but the thought leadership that you and Wes, also your Chief Innovation Officer, I've had the opportunity to interview Wes as well. I don't know, you're both an inspiration. And I think the industry really needs that right now, and we appreciate it. So before we wrap, though, is there anything else you wanted to share or anything you think we missed?
No, I don't think we missed anything. First of all, thank you for having me. It's a pleasure just being able to share, my personal journey and obviously our overall people journey with everyone in the podcast. One, maybe what I'll share with you is we can have the best tools. We can have the best technology. We can have the best processes, right? But at the end of the day, it's all about the people. And if we can remember that, because people are your differentiator. And I think if we can take care of our people, if we can invest in them, if we can provide them the tools that they need, they will take care of our customers. They will take care of our patients. They will take care of kind of whoever they're serving in turn. So just, sometimes in the world of tech and in the world of just ever-changing globalization, we forget that at the core of everything is people. And if we can always keep that in mind, I think we will be in a better place overall.
Well, I certainly appreciate and mirror your humanist mindset, because I share the same, and I truly believe you're absolutely correct. So thank you for being on this show.
Thank you, Beth.
The easiest way to reach Amaris is on LinkedIn, or check out the company's new website at TruBridge.com. And this has been Beth Friedman, Senior Partner at Fin Partners. I thank you for listening to Fin Voices, where we talk about health information, health innovation, and all the technology in between. So until next time, wishing you all the best in health.